Hey everyone, recording live from somewhere. This is Zach Couples with episode 1 of the Movement Debrief. My main man Alan Tucker inspired me to start doing this, and basically, I'm not sure where this is going to go yet, but I think periodically I'm going to do this type of thing to kind of help me and you guys with the art of reflection. I think that this is a concept that I kind of neglected early on in my career, and I got to give kudos to those people in my residency because they had taught me this concept early on, but it's just something I kind of neglected over the years. And so we're gonna we're gonna try and do that and see what happens. So I think reflection is immensely helpful because it allows you to kind of analyze where you went wrong and where you can do better. And so instead of me just going on and writing down my reflections for the day, I might as well share it with you, beautiful people. So, a little bit of housekeeping before I get into this first case, because that's where I'm going to start. I hope you guys checked out my new blog, zachcouples.com. I just wrote a post on the ultimate guide to treating ankle sprains. So, it was a pretty successful protocol that I devised, and I hope you guys find it beneficial. So let's talk about case one. So I saw this girl the other day, and she came to me because she felt she was twisted, and I don't mean that psychologically twisted. So basically, what happened with her is she had a fusion at L5S1, and this took care of her back pain, believe it or not. But she was kind of complaining of some shoulder pain, and she was a runner and just wasn't feeling that push, that push that she normally had. And so I went over to her place and kind of got to know her as I would normally do. And she used a lot of language like, I just feel out of whack, twisted, off balance. I feel like I'm shifted, all of these things, and thought that that was a contributing factor to her pain. Now, you guys will all know that the pain science guy in me was about to have a heart attack. But for some reason, this time I decided to take David Butler's advice and meet her at her story. Because I think if we would have jumped right into the pain science talk and said, can I talk to you about ion channels? I think this would have been a complete disaster because she had it in her frame of mind that this twistedness that was going on with her was causing her pain. And so I'll talk about the education after we kind of go over some objective findings. So I did all my normal testing, and the way I evaluate, if you don't know, I kind of look at the entire body. It's predominantly a PRI evaluation amongst some other things. And she was an individual who definitely had some asymmetries from a limitation standpoint. She was bilaterally extended, so had a lot of frontal plane limitations, in particular at the hips, and as well as some rotation limitations in the trunk. And so instead of kind of going into the pain talk with this woman, I just decided to take the story that she had conceived in her mind and tried to de-threaten that as much as I could while still incorporating her same language. And so what this involved was simply a biomechanics explanation of what was going on. And I used a lot of language such as, hey, when you're stressed or threatened or in pain, your body goes into a protective posture that's completely normal. And I did dive into a little bit of the biomechanics. So we talked a little bit about what the pelvis and the trunk was doing and why she might be limited going this way and that way using muscle tone. And I did this in a very non-threatening manner. And I think early in my career I would have shunned at that, but it's something that she got. And I think that a lot of times we can become short-sighted with our notions of the way we view movement and physiology and the patient interaction. And while I think eventually we need to have that discussion that maybe some of this stuff is not the reason why she hurts, but for her we had to provide an explanation that was meaningful. And I mean, after thinking about it, I don't think for one moment that this woman was frightened by any of these explanations. So don't be afraid to talk biomechanics with your patients if that's the frame of mind that they're coming from. You can slowly pull them away from that, but meet them at their story. And I think that's a lesson we all need to take into consideration. In terms of treatment, this was pretty straightforward, all things considered, that she had some problems. The big test that blew her away was a toe touch, or a standing reach test, and shoulder abduction, because those were the two things that were problematic for her comparable signs. And so what we did was two activities that were squatting variations. If you go to my YouTube channel, just YouTube Zach Couples, I should have these. The first activity was a wall reach. And so basically what we do with that, I could probably just stand up and show y'all. If you can see, imagine I'm on a wall, I'm tucked in this position, reaching forward, and doing 5 slow, controlled breaths, quietly in through the nose, long sigh exhale through the mouth. And that got some nice changes from objective testing. We almost got full frontal plane movement in the hips. And the coolest thing with it was she was probably about 75% from full range of a toe touch. I mean, we'll say like mid shin, and just after that activity, she was able to completely touch her toes. So she was blown away, which was cool. Still had a little bit of discomfort with shoulder abduction, and so she seemed to respond really well to squatting maneuvers. And if you go to, again, my YouTube channel, or actually if you look at my most recent blog, I use this activity called a standing supported IO and TA, and I got this from the Postural Restoration Institute. And basically what you do with that is it's a squat, but you're dorsiflexing your ankles and trying to push your knees forward as much as you can. And the intent of both of these activities was to get her to create abdominal activation so we could open up some space in the upper back and lower back. That was kind of the explanation that I had given her, and that's what we were attempting to do. And so by giving her a couple activities that got her out of this overextended posture, we were able to get full frontal plane mobility in her hips. She was able to touch her toes after that activity, and then shoulder abduction was pain-free. So all in all, it was a pretty successful first visit. That said, part of this reflection is, what could I have done to make that even more successful? So I think we did pretty well in terms of explaining to her why she was hurting. But are there treatment modalities that I think could have helped her carry over these activities a bit more? And I guess I'll find out when I see her again. But I think one thing too, and this is again my old clinician mindset coming out, but utilizing manual interventions to kind of help her find and feel in things. I think that's something that, especially in an individual who is maybe overly extended, would have benefited from. So maybe giving her something where we focused on manually pulling her ribs down as she exhaled, because that was one thing she had a hard time doing in these positions that I gave her. I mean, she was able to obviously get some nice changes, but the perfectionist in me thinks that, hey, maybe we could have done even better if we had given her some manual cues in hook line. But all that said, I think that the treatment was pretty good. I think the next time I see her, I probably will do a little bit of manual just so she gets a really good feel for things. And she's big into shoes. She's a runner. And so I think possibly going there as well and seeing what she can do or how different shoes impact her could be something that's beneficial for her. So afterwards, I sent her an email just kind of to debrief her and say, hey, just, great job today, and let me know how things are going. And cool thing, and this was just after one day, she said that she was able to run and felt like she had a lot more power, and was still able to keep her toe touch, and that's as of today. So one day later, and we already got a little bit of success. Otherwise, I mean, that's all I really have for this patient. I think, for future debriefs like this, if you guys have any questions in advance you'd like to have answered, go ahead and just hit me up on one of my social media outposts. So I'm on Facebook, obviously. Hi. I'm also on Twitter. Z Couples is my handle, and then I'm on Instagram, Zach ZAC Couples CUPPLES, and also subscribe to my YouTube channel, where I'll put some exclusive videos on there. And probably the most important way that you guys can get a hold of all of my information is through my website, and that's www.zachcouples.com. Sign up for my email newsletter. You'll be able to get some really good stuff from that, and you'll be privy to getting my new ebook before anyone else comes out there. So stay tuned. Thank you for listening. You guys are wonderful, and until next time.